Hey guys, welcome back to another episode of the Buy Yourself Flowers podcast. Today we are joined by Dr. Megan Moreno, a pediatrician, researcher, and professor whose work focuses on the intersection of technology and adolescent health. Dr. Moreno is the principal investigator of the Social Media and Adolescent Health Research Team, also known as SMART, and works as co-medical director in the American Academy of Pediatrics Center of Excellence, creating a healthy digital ecosystem for children and youth. Social media is something that has very much infiltrated itself in almost all of teenage life, but how much do we really know about what it's doing to young people's mental health and well-being? Today we're going to get into all of that and so much more, so let's get started. So can you walk us through your background on how you ended up leading SMART and what drew you to focusing on social media and adolescent mental health specifically?
Sure, I'd be happy to. During the time when I was doing the subspecialty training in adolescent health, I was at Seattle Children's Hospital and I was doing that training, which is often called a fellowship, between about 2005 and 2008. So this was a time where I was really learning how to provide care for adolescents. I was so excited. I had wanted, to pursue this path for so long. And one of the things I really loved is being able to listen to the stories that my patients told. And during that time frame is really when you started to see the rise of social media. So a lot of patients would talk to me about experiences they were having, and I feel like there's two experiences that really stand out. One experience is that I was working at a homeless youth clinic and we started to see more and more patients, and we thought, where are these patients coming from? Is it that there's more patients in our community, or is it that there's more patients who know about us? And so I started to ask patients, and they said that they were part of a community on MySpace for homeless youth to help them find resources. So that's why our patient volume was going up. So I thought, oh, this is such an example of a way that social media is helping provide people information to get access to care. And then the other example would be, I saw a patient who came in with really terrible stomach pains. And when I asked her when those started, she said, well, they started at 11 a.m. on April 26th, because that is the time that I opened my MySpace and I saw that these people at my school had posted these horrible pictures about me. And I have not gone back to school. I have not really been able to eat. And to me, that was the opposite type of experience, this really horrific experience that was impacting health. So that's been my journey. I've continued to listen to stories, ask questions, and my research really follows what my patients tell me are important.
Yeah, and I saw on your bio that you were currently working on a National Institute of Health study. Correct me if I'm wrong, but do you interview teenagers from ages 13 to 15 about their social media activity, like what they post, who they follow, what they like and share? And then I heard that you were doing some brain scans as well, following their social media patterns. And just about that study, are there any particular findings or observations that you're able to share with us? And what are you kind of hoping that this research will lead to in interventions for mental health?
Oh, such a great question. We're so excited about this project, and we're in year 4 of a 5-year project. So all the information we have so far is really preliminary and just
Yeah.
early suggestions of what we might learn. But as you so adroitly said, we are following youth that we've recruited at the ages of 13 to 15, and we follow them for 2 years. So each participant will have a 2-year journey in our study. So we'll get to learn about how their social media use changes, how they change, how their relationship with their tech changes. And as you mentioned, we are doing brain scans as well. And within the fMRIs, the functional MRIs we're doing, we are also doing tasks that relate to social media. So youth look at social media posts and we can see how their brain is responding to those posts, whether it's their own posts or a post from someone else.
Yeah.
So I would say one thing that to me has been an early finding is when we talk to young people about what they post and what they see from other people. I think one thing that has been really cool to learn is how much of it is really positive and healthy content. So youth are using social media to connect around community work, to connect around their sports, to connect. A lot of our participants are from rural areas of Wisconsin, so they're connecting around things they're proud of on their farms. And so I think that to me, it is really helped us understand that well-being side of social media and the way to share things that you care about and are important to you.
That's really interesting. Also, I saw, because I also on your bio it says American Academy of Pediatrics. What exactly is your role within this Center of Excellence, and what kind of systemic changes do you think should be administered?
Oh, that's such a great question, and maybe I'll break that in half
Yeah,
to address the Center of Excellence first. So, within the Center of Excellence, our goal is really to create resources for youth, for families, for educators, for healthcare providers that serve youth. That are evidence-based and are very practical. So we're really trying to move away from the narrative that that kind of is pretty prominent out there, that that either tech is all bad or tech is all fantastic, and
yeah.
we really try to sit in the middle to say, actually, we think youth are fantastic, so how do we support youth in this space and navigating it? And so all of our resources are really grounded in the evidence we have. A couple resources we're really excited about. One is a question and answer portal where you can go into the portal and submit a question. And we have research teams that will look through the published evidence and provide an answer based on the best evidence at this time. So it's not an advice column. It's really kind of, we will do the work for you to figure out the evidence. Another thing I'm excited about that we've been working on with our youth advisory panel that advise the center is they helped us build out what we're calling a Calm toolbox. So it is a resource where youth can look for different ways to try to relieve stress. Some of those involve technology and some of those don't. So kind of supporting the idea that what we want for every youth as they start to learn about dealing with stress, start to figure out what's in their Calm toolbox, is to have a resource of options where you can try some things and see what's working for you.
Is there anything specific that speaks out to you about the question and answer?
Oh, yes. We one question that we get a lot, and I feel like I've also been asked a lot in my work in clinic and my work in research, is how much screen time is the right amount? And it's so interesting to me that that is still a question that people really worry about and think about. And I think one thing we've tried to do within the center is say, hey, we understand that is a question that it's easy to get caught up in. And it would be great if there was an exact number of hours we could tell
Yeah.
people. But, really what we want people to do is be able to see media through a little bit of a larger lens. So we talk about, instead of 2 hours, we talk about the 5 C's. So that includes child. So who is that child? What is their type of media? What's their temperament? What do they like? The second C is content. So even if I told you a certain amount of screen time was okay or not okay, we both know it has a lot to do with what you're watching.
Exactly.
2 hours of like STEM on TikTok is really different than like 2 hours of doom scrolling.
Yeah.
The third C is calm, so finding ways to calm yourself. The fourth C is crowd out. So thinking about, rather than how many hours a day, thinking about, are there things that my tech use is crowding out that I want to find a way to crowd back in? So that might be things like sleep or cooking or other hobbies. And then the fifth C is communication. So having open, curious communication with the adults in your life, with your peers, just being really open to the idea that there's more than one right answer.
And I was going to say, for the MRI scans, have you found more of a positive correlation between teenagers' kind of brain activity when they see social media? Or do you think it's very much of a 50-50 with negative associations?
That's a really great question. I don't think that we have the evidence yet to be able to suggest that. But if I were to hazard a guess, I think what we're going to find is that it's not a uniform effect.
Okay.
That it's that certain teens who have certain characteristics might be more susceptible to these risks, whereas other teens who maybe have resilience in a certain area might be less susceptible to those risks. And that will allow us to think about how to tailor advice to people. So if you're someone who struggles with X and Y and you really want to do this, then maybe here's the ways that you need to do this that are going to make it safe for you. So I think that we are not going to find a really simple answer because, science doesn't usually work that way and brains are really complicated.
Yeah.
What I'm hoping is we'll learn some things that will help us be able to say, wow, you have these characteristics. Here's some things to be careful of, and here's some things to celebrate that are going to really make you resilient in this space.
I also saw that you work in the Youth Advisory Board initiative, which supports or funds researchers and clinicians to kind of set up their own youth advisory boards and get direct input from actual teenagers. And could you please tell us a little bit more about how that kind of initiative works and how your own research has kind of led you to recognize the importance of giving young people a seat at the table?
Oh, I really appreciate that question. Our team has been so fortunate that we have worked with our own youth advisory board for over 10 years. So I think early on, we learned that we really needed to have youth representation to help guide our projects and to help us interpret the findings that we had. So as you may know, the World Health Organization makes the argument of, youth should be involved in matters that are important to them. And we really want research to be something that is important to youth, that they benefit from. And so having mechanisms where folks can learn about research, both as consumers of research as well as future researchers, has been something that's really been woven into our workflow. So one of the things that I learned after working with our youth advisory board for a few years and giving some talks on it is that I started to be approached by other researchers saying, how can we do this? How do you even do this? So I started doing conversations with people and meeting with them and helping them, which really is how I got started, is I went and found people who
Yeah.
helped me. So it's always cool to pay it forward.
Yeah.
And then we ended up being able to have some funding from an organization called Pivotal Ventures. And it was also supported by Susan Crown Exchange, and who does a lot of youth-based work, and it provided us a lot of great guidance. And so what we set up was a program where people who were interested in developing their own youth advisory board could come, and we would do that work together over the course of a year. So not only would they learn from us, but they'd learn from each other. They'd learn from their experiences. If you end up taking a couple steps to the left and it didn't go as well, that way we can all learn from that and make our own boards better. So that was a really great program, and we've been able to stay in touch with those folks and be able to see what their boards have grown into.
And do you have any examples of some cool projects that you've kind of come across over the years?
Yeah. I think one of the areas I was really excited about is a couple of the youth advisory board groups were working on launching new clinics. So they really benefited from youth input on everything from what should the art look like in this clinic? Where should we be advertising this clinic? What should the clinic information that we give to patients look like? How can we really make this a space where youth are going to feel welcome and thrive? And I think by having their input from the ground up on what they wanted that clinic to look like really allowed them to design in a really thoughtful way. And that was not something I was expecting to come out of this is input on clinic design, but it was incredible.
And for the young people and parents who are listening, what are kind of some important takeaways from your own research, and what do you think needs to change at a wider level to improve teenage mental health in relation to social media?
Oh, I love that question. So let's take the wider level first. I think one of the things that we are learning through our work at the center, and I am learning through patients and our research studies, is that elements of the way that many digital platforms are designed really need to change. We really need kind of a revolution within digital design, and we need to think about how to design for well-being. And designing for well-being is really different than design for profit.
Mhm.
So I think that right now there's a lot of discussion about bans and a lot of discussion about limitations. But my worry is that takes us away from the idea that actually we need better settings, we need better design, we need better ways to control your content and your algorithm. So to me, the bigger picture right now is how do we define what well-being looks like in digital platforms and then design for that outcome.
Mhm.
Now, what do we do while we're waiting for that to all get fixed? So, right now, I think a lot of what that looks like is having a learning mindset and a curiosity mindset and moving away from discussions that center on blame or shame or that there's only one way to do this right. And really being in a space where both adults and youth can talk about their experiences, can learn from missteps and mistakes in a really blame-free way, and be able to support each other in both our time online and our time offline.
And what about your specific research? What have you found to be the most important kind of aspect of it?
Yeah, I think one of the things that I feel like I've learned over and over and over is how incredibly savvy youth are in coming up with solutions when they're worried about their tech use. Little hacks that they have, ways that they share with each other, best practices. In the adult world, we spend a lot of time thinking about like, what should it look like in schools? What should we teach in schools? And the reality is, I think what I keep learning over and over is if they had those classes, youth could probably teach them because there's just so much creativity in the solution space that comes from youth.
Yeah, that's really interesting. Okay, I think that's all the questions that I've prepared for you today. And I want to thank you so much for coming on because I learnt so much.
Oh, it's been my pleasure. I really appreciate the time spent with you.